Hello, my name is Mei Kwong. I'm the Executive Director at the Center for Connected Health Policy. And for today's video, we'll be talking about what is telehealth policy. This is another part of our Telehealth 101 training webinar series here. So this is for people who are new to telehealth and want some of the basic foundational information around telehealth and telehealth policy, but it can also act as a bit of a refresher for people who are a little bit more experienced. Before we begin, a couple of quick disclaimers. Know that any information provided in today's talk is not to be regarded as legal advice. It is strictly for informational purposes. CCHP always recommends that you consult with legal counsel if you're interested in a formal legal opinion. And also, if I happen to mention a company or show a picture of some type of product, know that neither I nor CCHP has any type of relevant financial interest, arrangement, affiliation, or relationship with such a company. So we're going to go over a little bit on what is telehealth policy. And to understand telehealth policy, you have to understand that there are many levels of telehealth policy and where that policy is developed. So you have your federal level and things that go on with Congress and what the president signs and the federal agencies that administer some of those statutes and implement those laws. And then you also have on the state level and certain laws and regulations that they implement and the Medicaid program. So this gives you a bit of an overview of sort of the areas that the feds might be in control of and the state might be in control of. So underneath the federal umbrella, you have Medicare, HIPAA, and prescribing of controlled substances. And underneath state, you have Medicaid, private payer laws, licensing, and prescribing and establishing patient-provider relationship. It's also important to note that in some ways, what happens on the federal level definitely impacts the state, and what the state does can sometimes influence the policy that is implemented on the federal level as well. For example, a Medicare policy that's put out on telehealth, if states don't necessarily have a policy themselves that directly impacts that particular issue that the federal policy did, a state may adopt what they did on the federal level in the Medicare program as their own telehealth policy for the state. So there are different connections that can be made on what happens on the federal level and what happens on the state and how they influence each other. Now, what are some of the policy tracks on getting the policy actually made and implemented? So the first one, the big one, is legislation, and this can happen either on the state or federal level. And what it means is that a bill is passed, it's signed by the executive for that particular jurisdiction, so either the president or the governor, and then it becomes law, either federal law or it becomes state law, depending on what jurisdiction you're talking about. And as most people know, it comes in the form of a bill, passes the legislative body, signed by the executive, and then it gets put into law, becomes part of the statutes for the state or on the federal level. Now, one thing though is that is the law, but if there's something for an administering agency to administer that particular law, you also have another layer of policy that takes place and which sort of shapes how your telehealth policy is enacted there. And those are through regulations or administrative actions. So what they do for this is that they may provide more details for that law that's in place there. And you can do it through a regulatory agency, such as through CMS, if you're talking about a law that impacts Medicare, or if you're talking through Medicaid, whatever agency on the state level is administering the Medicaid program, or it could also be licensing boards. Licensing boards also issue sometimes regulations, or they provide guidances to their licensee on how they are going to approach or how they're supposed to do things. So a board may issue a guidance to a medical board may issue guidance to doctors saying this is how you would take care of something when you're using telehealth. For example, they may require that the physician make the patient aware of the certain types of providers that they can meet with in person, as opposed to just simply interacting with them over telehealth. So it's also important to look at what some of the regulatory boards are doing as well, because they also can craft telehealth policy. And then one other area is also private payers. Now, for a lot of you may be familiar that a lot of states have private payer laws. So these are laws telling commercial payers, health plans, what they're supposed to do around telehealth, what they're supposed to cover. But again, sometimes the law is very broad or it doesn't have a lot of details. So the private payers can craft their own policies where they are still in compliance with the law, but they may have certain features in there that, aren't covered by the law, but may dictate how you're supposed to use telehealth. Again, you may have, for example, a state that says, well, a health plan must cover all services delivered via telehealth. Okay, that's fine. So like a health plan in that state will cover all their services, if they're, regardless of whether delivered via telehealth or in person. But let's say they're going to pay the telehealth delivered services at 50% of what they would have in person. They're still within like the parameters of the law, because the law didn't say anything about payment. It just said like they had to cover the services. But the policy of that commercial payer definitely impacts the delivery of that service and also the reimbursement for it. So also be, really aware of what the law says, but also how it's being administered and also the policies that surround it, which can come in a lot of places, either through licensing boards or an administrating agency, or through like private payers if it involves like a commercial payer. Here's an example of that. So you have like the statute, the law, and this is the Medicare law regarding telehealth on the federal side here. So it says for the Medicare program, the secretary shall pay for telehealth services that are furnished via a telecommunications system. And that's what it says in the statute. Well, CMS is the administering agency, so they create regulations on how they're going to administer this charge that they have from federal law. And for this particular section, they wrote in the regulations that Medicare Part B pays for the covered telehealth services, including on the telehealth list, when furnished by an interactive telecommunication system. So they added that word interactive, which if you look at the example above, does not appear in the federal law. But there's nothing in there that says that they couldn't put the word interactive there. All the federal law said was telecommunication system. By CMS putting that word interactive, that really reduces the type of modalities can be used. It has to be something that takes place in real time where the patient and provider are interacting with each other. So that means live video, or in some cases now, like we're talking here on September 16th in 2021, audio only possibly too. So that little word that they add in the regulations for them to administer the federal law does have an impact on like how telehealth is going to be covered then in the Medicare program. So it's very important to like pay attention to both not only the federal law, but also how it's being administered and what policies that administering agency or that program or that board or that private payer, how they are like interpreting what that federal law is charging them with to do. So those are just a couple of like highlights for you to understand how telehealth reimbursement policies put out there, and also how to understand how some of this policy is being implemented. Please go to the CCHP website for more information and details. Also, you have a chance, you can also subscribe to our CCHP newsletter if you're interested in more information from us. But otherwise, I hope to see you on another video. Thank you.